Okay, guys, now we learned about sperm selection, sperm, how to do semen analysis and all. Now, in this video, we learn about ovum pickup. Okay, if you didn't see that video, please visit that video of semen analysis and please do view that video. Now, coming to second part of this video is ovum pickup. That is oocyte retrieval. Okay, so OVA recovered about almost, see, we'll give HCG injection for OVA rupture, right? Ovulation for ovulation. So after 34 to 36 hours of HCG injection, we'll do OVA retrieval. Okay. So generally it is done under ultrasound guide and under light general anesthesia. So what the equipment required? We need an ultrasound scan with transvaginal probe. With that probe only, you'll get one space for needle guide. Okay, and we have aspiration needle. In that needle guide, we'll insert one more needle from outside. So that is aspiration needle, single lumen or double lumen. Okay. Coming to suction pump with vacuum regulator. It has two pumps, which is collected into that. The fluid will be collected into that container. So for that, we need to create a suction pump. So suction pump should be present. After collecting the ovum and the liquid, we'll see in the under microscope. So that is in a stereo zoom microscope. Then we need to have heating blocks with heating stage, sterile water cabinet with laminar airflow and heating stage. So some disposable materials are required. Obviously, gloves will be required, and this is for there is a Falcon round bottom test tube of 14 ml, very big test tube. It is not like a EDTA tube. It's not like that. It's very big test tube. It is 14 ml, and there is a Petri dish. There is a Petri dish known as Falcon 60 mm dish. Okay, and transferring this liquid into the dish, we need a pipette. Okay, that is transfer pipette or cylindrical pipette. Then we have four well dish. There is four well dish. Okay, then Falcon central well dish. Falcon central well dish. Okay, culture media mineral oil compatible ART tips. Following steps are involved in this procedure. The patient is placed in lithotomy. First, we'll keep in lithotomy before oocyte recovery. Patient vulva and vagina cleaned with sterile dilute betadine. Dilute betadine. Then we'll insert a transvaginal probe, which and is cleaned with soap solution. We'll take a probe and we'll clean that with soap solution and milk water, and we'll cover with some sterile probe cover. Then insert in this is insert into the vagina to see number and location of follicles. Then ensure that ovulation has occurred or not. If ovulation has not occurred, then we'll abandon the procedure. Once ovulation occurred, then only we can retrieve the ova, right? Then the transvaginal probe has been closed again and covered with sterile probe cover. The sterile probe guide to hold the needle is attached to the probe. See, this probe, this previous probe will keep a cover. On that cover, we'll keep one steel, what you can say, holder, needle holder. Okay. Then we'll give general anesthesia with propofol. So before giving anesthesia, only you'll check whether ovulation has occurred or not. Then we'll give anesthesia. Then a probe is inserted back into the vagina. Sterile disposable needle, double or single lumen, is inserted through the guide and pierced to the fornix of vagina to enter the pelvic cavity. The probe is moved to visualize the follicle. Then tip of the needle is pushed into the follicle with quick thrust. The tip is with the thrust we insert into we'll see the follicle and we keep into that follicle that needle. When the needle tip is inside the follicle, foot pedal is there. The doctor have a foot pedal near the foot. They will be having a pedal. They'll press that, so all the fluid will come into the test tube. Okay. So foot pedal is pumped as per the follicular fluid in free. See, in that test tube, already we'll keep of 10 ml of warm sterile saline, warm water. Okay, 10 ml. Okay, then and we'll apply pressure. Pressure should be less than 10 mm. Okay, in case of follicle flushing, like if the follicle is getting yeah, what we'll say, if it is getting um, deflated, then use using double luminator, then follicle collapse, yeah, it is collapsed, then you'll use a flushing medium. Again, we'll pump some fluid into that, into the follicle, and we'll aspirate back into the tube. Okay, and we'll repeat this procedure. If there are six follicles like this, then we'll repeat this procedure till all the follicles are aspirated from both ovaries. Okay, that's important. Coming to if you see these images, so um, this is a 1 ml syringe. Okay, this is totally it is point one, so 1 ml syringe. This is a pipette, cylindrical pipette. This is a petri dish, which is 60 mm dish, and this central well dish, and this 4-well dish. Okay, you know this. Okay, coming to images, ovum pickup procedure. They're picking up and by pressing the foot pedal. Then see this is see if you see this image, they have a double lumen thing. Okay, and if you see this image, there are totally almost 3 follicles, and in that if you see properly, the needle are being inserted into one follicle. I think this one, this is the needle. Okay, they're entering. This is entering. This is the needle. This is the needle. Okay, this is getting entered into the follicle and getting aspirated. Okay, the fluid coming to pick up, we picked up na we picked up that um, uh, okay oocyte cumulus complex. Okay, that complex is being collected, and we are seeing that. Okay, we are seeing washing, we are seeing that. Okay, we are washing now. Here she is washing under microscopic guidance. She is washing that total fluid which is being collected. Okay, coming to lab procedures. So once we collected the fluid, now we'll send to lab immediately. Aspirated follicular fluid from the patient ovaries are immediately transferred to the laboratory for evaluation of oocytes. Skin the entire follicular fluid under stereo zoom microscope. Zoom microscope we'll use. Divide the fluid into 2 or more petri dishes. So we'll divide into. We need to make a thin layer. Okay. So we'll divide into thin layers so the fluid is scanned quickly for the presence of oocytes. The fluid is rapidly scanned for the presence of oocyte cumulus complex. So oocyte cumulus complex is the one which we are searching. Okay, we'll see that. We'll see oocyte cumulus complex. Okay, or else cumulus oocyte complex also. Okay, that we want to see. After recovering the oocytes, give 4 to 5 washes of flushing medium to remove the debris and then shift to the incubator. Okay, this is about oocyte retrieval. Next, I'll tell about ICSI. Okay, but once we'll see the images, this is cumulus oocyte complex, which I told na cumulus oocyte complex. If you see, they're collecting that. Okay, coming to this one, the oocyte is in the center, and many cumulus cells are seen around the oocyte. This is a low quality oocyte. This is oocyte, and this is cumulus, which is low quality. Another oocyte, and you can see polar body on 10 o'clock. At 10 o'clock, if you see this is the polar body. Okay, see, this is the polar body. So this polar body is present on the oocyte. Okay, then if you see, it's a good looking oocyte. If you see good looking oocyte, it is like a moon. If you see moon na, on that, how there are pimple type of acne in that way, that is high quality oocyte. Okay, this egg omelette type of oocyte is there, so na, it is very immature egg. Okay, tightly packed cells. Okay, which I'll tell later. If the tightly packed cells or loosely packed cells, what will be the grading? Okay, that's for embryos. But yeah, this is very immature packed cells. And if you see this total omelette type, it is like burnt omelette one. Okay, many RBCs are seen. Okay, and what is this 4-well dish means? Once you find out that cumulus oophorus complex is na, then we'll take that 4-well dish and we'll keep in that dish. That's cumulus oophorus complexes. We'll keep into that dish. Okay, that's about oocyte retrieval. I'm thinking to show you some videos of oocyte retrieval. Okay, we'll see that.
I put the ultrasound probe in, and I decide which ovary is the best to start with, based on things like its position.
So if you see, this person has kept that cover to the transvaginal probe. Okay, sterile cover.
In her case, I think the right ovary is perfect.
So totally, he examined the ovaries before retrieval. Okay, in the right ovary, if you see, almost so many follicles are being present.
That the image is such that I can see the entire ovary at once, and then you start right.
Okay, if you see, there is a collecting chamber, and it is double lumen. This is double lumen one, and the collecting in that 14 ml falcon tube.
In the middle, and we're going into the first follicle now.
So he went into first follicle and retrieved that fluid in one test tube.
And then you bring the sides of the ovaries to you, so you never have to go out to the sides. I like to move the needle a bit. I'm right in the center of the follicle, but I move the needle because that appears to improve the chance of retrieving an egg from that particular follicle. And so I can tell when it's empty, but so can the aspiration assistant. She can tell me when it's done. So in the vast majority of these, the egg is floating around in the black area because black on ultrasound is fluid. And so as you go in,
Okay, in that way. So in that way they're retrieving. We'll see another video on this. Okay, that is a test tube probe. That is a TVS probe, and there is a needle holder to the TVS probe in which needle can be inserted. So thanks to Aishwarya Fertility Center video, I am just using for my study purpose. Thanks to their video. So if you see, they've entered into the follicle and the follicular fluid being aspirated. Okay, this way. So egg retrieval is a procedure where we do under a propofol general anesthesia because it is a little bit painful procedure, right? So thanks to this Mamta Fertility Hospital as well, I'm just using their video for the study purpose. So this doctor has been taking that needle, aspiration needle. Okay, that steel one is aspiration needle which she took. Okay, this transvaginal probe, and she took the aspiration needle, right? So they're collecting the follicular fluid. Immediately they're giving into the lab. So this is a Falcon's Petri dish. After collecting the oocyte, cumulus oocyte complex, we'll keep in the incubator. Okay, these are different videos. Okay, next we learn about ICSI and we'll see the next videos as well. Okay, thank you.